So then, did you go in for the resection?
Yes, I had that done on the 24th of October 2012 at QMC, Queen's Medical Centre.
And of course, you happened to be working there previously.
I used to work there, so I'm very familiar with the processes. Sometimes when you work within a profession, you don't make a very good patient because of my health, etc. They said I'd be in hospital for a minimum of 7 to 10 days. But as I said all along, sort of my body weight did help me because I was up and hobbling about the ward day one after surgery, post-op.
Were you quite determined to get up and about as well?
Yes, I was.
It wasn't just your weight, it was your outlook, I think.
I was determined. Determined to the extent that they wanted to discharge me after 5 days.
Really?
And clearly I had to remind them that I hadn't had a stare assessment. They hadn't asked me about my social circumstances to know, did my house have a banister, what support, etc. did I have? And physically, I knew I wasn't ready to be discharged after 5 days. So again, I told them that I wasn't going home. Because the other thing again is sometimes patients think that you have to accept everything that is being said to you by the doctor or the consultant. And you can question and challenge them, but be diplomatic and professional and courteous when you're talking to them. Example, the doctor that wanted me to discharge me, I sort of said, look, you've got a duty of care to me. You've not done this, and I pointed everything out to them. And it's sort of, they were a bit surprised because they weren't aware of my background. Some months later, after I've sort of had the procedure and I'm being reviewed, I had to go back and see the consultant. And I didn't remember his name. And when he walked in the room, he referred to me as his favourite patient. So when he came in the room and I realised it was him, I just said for a joke, your favourite patient's here. And he just started laughing because he remembered that banter that him and I had in the hospital when he wanted to discharge me after 5 days.
Yes.
So I'd clearly say to anybody, if you don't feel physically fit and able or ready, you need to speak up.
Well, you raised an issue that was pertinent to you, and it was addressed. It probably wouldn't have been addressed if you hadn't have raised it.
No.
But you still stayed on good terms with the medical team.
Yeah.
In fact, maybe even better terms.
Yeah.
So things can work out, even if, at face value, you do need to raise an issue. Like you say, you can do it these days. It's more accepted than it previously was.
Yes, that's correct.